Hello everyone, konnichiwa. I am Hiroshi Ohuchi from Kamogawa, Japan, and I would like to introduce some of the articles from the August issue of the Arthroscopy Journal. Talbot et al. Designed and evaluated the Shoulder Objective Practical Assessment Tool. It was trialed by members of the British Elbow and Shoulder Society Education Committee for internal consistency and ease of use before being offered to other trainers and residents. 140 orthopedic residents of varying seniority within 5 training regions in the UK were questioned regarding the tool. A pilot on 6 residents was undertaken. Internal consistency was 0.77 and inter-rater reliability was 0.6 and the intra-rater reliability was 0.82. Spearman's correlation coefficient was 0.74 between the global summary score for the Shoulder Objective Practical Assessment Tool and the current assessment tool used in postgraduate training for orthopedic residents undertaking diagnostic shoulder arthroscopy. 82% of residents strongly agreed when asked if the Shoulder Objective Practical Assessment Tool would be a useful tool in monitoring progression. 72% strongly agreed to the introduction of the Shoulder Objective Practical Assessment Tool within the orthopedic domain. The authors concluded that the Shoulder Objective Practical Assessment Tool fulfills several aspects of reliability and validity when tested, and that it has the potential for playing a role alongside the current assessment tool in the training of orthopedic residents. Abrams et al. Performed a study to determine the effect of different types of capsulotomies on hip rotational biomechanical characteristics. They used 7 cadaveric hip specimens and external rotation was produced by applying a torque of 10 Newton meters to the hip specimens. Specimens were tested in neutral and 40 degrees of flexion in the following capsular states: intact, interportal capsulotomy, T-capsulotomy, repaired capsulotomy, and capsulectomy. They found that with the hip in neutral flexion there was increased external rotation with a T-capsulotomy and capsulectomy compared to the intact hip. After completing repairing the T-capsulotomy, there was no significant difference in external rotation compared to an intact hip. No significant differences were observed between groups at 40 degrees of hip flexion. Kim et al. Performed a study to determine whether concomitant chronic syndesmotic injury or chronic medial ankle instability are associated with unsatisfactory outcomes in patients with chronic lateral ankle instability. They performed a retrospective review with prospectively collected data on 276 male military patients with chronic lateral ankle instability who had undergone a modified Brostrom procedure. They reported that patients with chronic lateral ankle instability and the combination of both chronic medial ankle instability and syndesmotic instability had an 11.7-fold higher risk of having unsatisfactory outcomes, even after all 3 components had been reconstructed. Bishop et al. Performed a systematic review investigating the association of smoking with rotator cuff disease and shoulder dysfunction. 13 studies with a total of more than 16,000 subjects, of which approximately 6,000 were smokers, were included. The authors concluded that smoking is associated with rotator cuff tears, shoulder dysfunction, and symptoms, and that smoking may also accelerate rotator cuff degeneration and increase prevalence of larger rotator cuff tears. Bird and Jones reported the results of hip arthroscopy among high-level baseball players as recorded by outcomes scores and return to baseball. 44 hips among 41 intercollegiate or professional baseball players who had achieved 2-year follow-up were included, and numerous diagnoses were treated with various procedures. They reported that players returned to baseball following 42 of 44 procedures at an average of 4.3 months, with 90% regaining their previous level of competition, and that there were no complications. And finally, as Lubutz discusses in his editorial, I would like to recommend everyone to view the technical note and video on dry arthroscopy of the elbow by Fadnis and Bain in Arthroscopy Techniques at www.arthroscopytechniques.org.